New hope tonight for the nearly 4 million Americans dealing with one of the most common lung diseases.
It is a non-surgical procedure that dramatically improves lung function and quality of life. CBS 2's Dr. Max Gomez here now to tell us it involves putting coils inside the lungs. Doc.
That's right, Maurice and Christine. Emphysema, or what doctors call COPD, that's short for chronic obstructive pulmonary disease, is a terrible problem caused primarily by smoking. Once it gets to advanced stages, medications help just a little, leaving only major surgery or transplants. Now a clinical trial is offering relief. Mary Morgan spends her days and nights hooked to an oxygen tank. It's the only way she can get enough oxygen in her blood to stay alive.
I could get from my chair to the bathroom. I could barely speak a couple words at a time, then I'd have to stop and take a huge breath.
Mary has stage 4 emphysema. The massive effort it takes to breathe caused her to lose a dangerous amount of weight and be in constant pain.
I guess from using different muscles that you don't usually use, and I was using them to breathe.
All other options exhausted, Mary volunteered for a clinical trial at the Cleveland Clinic that uses a very different way to treat advanced emphysema. The key is understanding what COPD does to the lungs.
Airway collapse eventually leads to air trapping and hyperinflation of the lungs.
In other words, the diseased lung is so overinflated it compresses the remaining healthy lung tissue, preventing it from working normally. Now Dr. Maida is using metal coils to treat the problem. Using a bronchoscope passed through the mouth and into the lungs, he carefully inserts thin metal fibers that spring back into their original coil shape, pulling the diseased lung tissue with it and leaving room for the normal lung to breathe again. Within 24 hours,
Improvement in their quality of life, their walk distance, their effort in breathing.
It was an immediate difference. I felt like my chest was so light and relaxed.
the clinical trials are just beginning at 24 medical centers in the U.S., including the Cleveland Clinic. Results won't be known for at least a year. But this is not a cure for COPD. It improves quality of life and the ability to function daily, and hopefully will extend life for these patients. Maurice, Christine?
Okay, Dr. Max.